Hey everybody, welcome back to my channel. My name is Joy. I'm a neonatal nurse practitioner living here in Houston, and I make content about becoming a nurse practitioner, living here in Houston, and how to achieve your goals. If that sounds like something you're interested in, go ahead and push that subscribe button and let's get into the content. As promised, this week's video is going to go over things that I asked when interviewing for my neonatal nurse practitioner job, questions that they asked me that I can remember, and any tips that I may have or any tips that I can think of to help you guys out. I hope this video is helpful for you guys. It's tough being a new grad trying to get a job out here. The one thing I can say, in 2023-2024, NNPs are in demand. We're not out here struggling trying to find a job. So you're interviewing them the same way they are interviewing you. So let's get into the questions that I asked them during my interviewing process. Okay, so I have my notebook here. We're going to talk about the questions that I asked them. But one thing I want to say first is I did not ask them any financial questions. I did not ask how much money I was going to be making or about bonuses or sign-on bonuses, moving, relocation. I didn't ask about any of that kind of stuff in my interviewing process. I waited until they gave me an offer, and then I started to negotiate the salary. So I will talk about the negotiation of the salary at the end of the video. Right now I'm going to talk about what I asked them, and then I'll talk about what they asked me. So one of the things that I asked them about my schedule. What would my schedule look like? And remember, when you're thinking of the questions that you want to ask them the questions that matter to you. Okay, so my schedule mattered to me. I wanted to know, am I working 12s or am I working 24s? Do I start at the bottom of the total pole because I'm a new grad, so that means I'm working all the holidays and weekends, or is there a rotation? So these are questions that I asked about my schedule, and I was very happy with the answers. But if the schedule doesn't matter to you, to each his own. I wanted to work 24s, and so that's what my schedule is. I work 7 24s a month. I wanted to know if this schedule was self-scheduled or if somebody's just picking my days, and I am self-scheduled, so I was happy with that. We are a small practice, and so our holidays are pretty much broke up by, who's comfortable with working what. The fact that I don't have small kids is not, I don't really have like a preference. I need to be off on Christmas or I need to be off on Thanksgiving. So that's really a plus for my teammates, and that's something I can offer them because, how it is when you have small babies, you want to be at home. So I'd rather be off like New Year's Eve. You know what I'm saying? I want to be outside a little bit. My daughter is older, and also she goes with her dad on those family type of holidays, and so it wasn't a big deal for me to just say like I need Christmas off. But if holidays are a big deal to you, you should definitely be asking and get a clearer picture of what your schedule is going to look like when doing these interviews, because then it may play a part in your decision. Another question I had for them was the number of patients that the unit could hold. Okay, because we all know that the NICU may say we have an 8-bed unit, but then you visit and it's like 16 kids there because the babies keep coming. They always just keep coming. And so I did ask, how many patients does this NICU hold, and what is your regular census? Like, what does the census usually look like? I didn't want a really big, busy unit. I come from a 150-bed unit, very busy, several medical teams, several nurses, 400 nurses. I didn't want to go back to that. I wanted a more low-key situation where I can learn how to be the best nurse practitioner I could be and manage my patients without being overwhelmed. And so I was very happy with the fact that my new job is a smaller level 3 and it's not a 150-bed unit. But if that's what you want that high acuity, that level 4, that massive unit, then you need to make sure you're asking these questions because that is what is important to you. Have they trained a new grad? When was the last time have they trained a new grad? Do they feel comfortable training a new grad? What are their expectations of me as a new grad? Like, where do they think I should be able to start versus finish? My orientation, I told you guys, is 6 months, which I'm so thankful for, but you know, some people might be like, 6 months is too long. I don't want a 6-month orientation. I want like a 3-month orientation. Listen, that is for you to discuss in your interviewing process. Okay, that's when you decide, like, what do you want? I was really happy with, as a new grad, I get 6 months. I was very happy with that because I want to be very capable and confident. When I'm not saying I'm just going to be so confident, but I want to be confident enough to take the team and to make it through the night and be confident in my decisions. And I feel like 3 months wouldn't be long enough. I mean, right now I'm moving into my 2nd month, so that means I would only have 1 more month of orientation. I feel like that's too soon. So 6 months, perfect for me. So make sure you ask them about that orientation. What will it look like? And how do they feel about training you as a new grad? If they've never trained a new grad, they may not even know where you are, like, level wise. So the expectations could be crazy. Like, they might not know. So I feel like me asking them, have they ever trained a new grad before, really helped me kind of evaluate where they were and where they would expect me to be as a new grad, if that makes sense. And I asked these questions of both the nurse practitioners and the neonatologists, because at the end of the day, like, the entire team will be teaching you. You will be learning from the entire team, all of the doctors and all of the nurse practitioners you work with. So it's important to figure out, are they comfortable with training you? One thing I asked them is, what do they like about working for the company? And this was able to give me an insight of, like, you know, things that the company offered or provided to the nurse practitioners, just so I could kind of see. And so things like CEU reimbursement, and so you get this money every year. You can use it for your continuing education, which is nice because some of the places I interviewed do not offer that. I asked them about opportunities of advancement and, you know, where have they gone in their career since they've been with this company. So it kind of just gave me an insight of, like, okay, so there's levels of advancement if I want to do that. There's opportunity for continuing education. There's support. I asked them about support, like, as far as resources and things like that. So this kind of gave me an opportunity to kind of see where the nurse practitioners were. Obviously, it was just us in the room, and so they were able to give me very honest answers, and I was happy with the answers. So that helped in my decision making. Another thing you want to ask is about the makeup of the team. Like, if you work at a bigger hospital, you may have 7 medical teams. The team could consist of an attending, a nurse practitioner, a fellow, a resident. You know, it could have a lot of people on the team. So something you need to ask them is, like, what do the teams consist of? I'm at a smaller hospital, so it's the nurse practitioner and it's the attending. Perfect for me. But, you know, if you need more support or if you want to work on a bigger team, it would be nice to work at a bigger hospital, because then you're going to have so many more people to bounce ideas off of. Stuck on your patient, you can always talk to your fellow, bounce ideas off of them, talk to the attending, bounce ideas off of them. So that depends on your personal style and what you want your career to look like. I asked about feedback too. That was another thing. I asked them, like, how often will I receive feedback? Will I have a mentor in this role? That was important to me, because if I can't get feedback on if I'm doing well or not, I just feel like, how do you grow? Like, how do you know, okay, I'm doing good here, but I need to improve here? So that was important to me. And with my job, we have monthly meetings. I actually just had my first one. But you have a monthly meeting going over your progress, where you are, where you should be, things like that. And I really like that. So the last question I might have asked them would be, what exactly are they looking for in a new grad as far as an NNP? And then this kind of gave me a perspective of what they wanted. So I feel like the fact that I came from a level 4 facility, I've been a nurse for 6 years, and I've been at that company for 7 years. It was what they were looking for. They wanted somebody who had been stable on their job, who had worked at a level 4, who had a good personality, because our team is small. So if you are not there, you don't have a good personality, it's pretty hard to come into a very small team. So I feel like I kind of fit the part for my team. It to me was a perfect match. Okay, so let's get into the questions that they asked me. And I will tell you, I can't remember the exact questions that they asked me. And also, I told you I went on 5 interviews. So I just have a few. And if you guys want another video going over more of them that I can think of, I will do that. But I'm just going to hit on a few just so you can kind of get a picture of what those interviews look like. So just to start off, I'm going to tell you straight off the bat, you're going to get a bunch of behavioral questions. And when I'm talking about behavioral questions, the ones that none of us like, I'm talking about, tell me a time when you had conflict with a coworker and how did you resolve it? Tell me about a time when you had a difficult family. Tell me about a time when you made a mistake at work. Tell me about a time when you didn't agree with the physician and how did you handle that? I would say for these behavioral style questions, you can Google. You can literally Google nurse practitioner interview questions. You can practice them. You could have ChatGPT write you out a list of 100 nurse practitioner interview questions and you can practice them. I would say have at least 5 scenarios that you have in your head that you have memorized and that you can apply to these questions. So think about that family that was difficult and have that in your head for any type of question that comes up about a difficult family. Think about the time when you did have conflict with a physician and, you know, how did you resolve it? Like, have those scenarios in your head because those type of questions will come up. And what you don't want to be doing is this, thinking like you didn't prepare. You have to be prepared for this interview. When I tell you the interviews are long, they're all day or for several days. So you need to be prepared. You need to practice. Do not try to just walk into this interview and wing it because you will fail. The next style of questions that the team asks are clinical questions. So with this job in Houston, I thankfully did not have those situations. I didn't have that. But I told you I interviewed other places and they ask clinical style questions like, okay, if a baby is on bubble CPAP and their belly is blowing up and the nurse comes and tells you, like, what are you going to do? And then, of course, when you say go look at the baby, they're like, okay, so what's the next thing you're going to do? They have those type of questions like, what are you going to do? Okay, the gas is X, Y, and Z. What are you going to do? The x-ray is showing this. What are you going to do? They have clinical style questions. Hopefully, they won't have a lot for you. I mean, you're a new grad, so it's not like you just know everything. But be prepared for some of those clinical style questions as well. All right, and then the last part I want to talk about is once I got my offer letter, I looked at my offer letter and I was happy with it. But was I very happy with it? No. I will say that Houston does pay very well compared to St. Louis. Very well compared to St. Louis, but it also was beat out by another offer in Texas, in Austin. So with that, I had these offers on the table and I had something to compare stuff with. And yes, you can negotiate your salary as a new grad. I know as a new grad, we feel like we can't walk in and negotiate, but the worst thing somebody can tell you is no. So I would say no matter what, try to negotiate your salary. Definitely try to negotiate your relocation if it's not big enough. The relocation for Austin was like massive and really, really nice. Like they set the company up for you and everything, make it very easy. So that was like great too. Like they had a lot of good things they were offering. But yeah, you can renegotiate your relocation or your sign-on bonus. And yes, you should get a sign-on bonus. Even though you're a new grad, you can still get a sign-on bonus. So you can negotiate your sign-on bonus. It's not just your salary. You can negotiate your PTO. Like there's things you can negotiate, your bonuses, stuff like that. So if they can't move on the yearly salary, see if they can move on something else. You know, just negotiate. Don't just take the first offer you get. That's all I'm saying. Because if I wouldn't have negotiated, I'm not going to tell y'all what I make. I'm just telling you, negotiate. And I got that tip from one of my nurse practitioner friends who did not negotiate on her first job offer, and when she went to her second one, she negotiated. And so she told me no matter what, negotiate. And I'm so thankful to her for several reasons, but that is just another reason why I'm so thankful to her. But anyway, I hope this video was helpful for you guys, and let me know if you want to see anything else. You have any more questions about what I talked about today, leave it in the comments. Make sure you subscribe so that you can get the video about my 3-month update as a neonatal nurse practitioner. Alright guys, I'll see you next week. Bye. Baby girl, you are so pretty, 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 pretty.